Hello everyone, I am Dr. Umar Kharadan. I am a Chief Neurologist of Baby Memorial Hospital, Calicut. Today I would like to speak on a subject called hemifacial spasm. It is nothing but a spasm of the facial muscles, starting from the eyes, going to the middle, to the mid facial level and to the lower part, and at times this muscle called platysma. This tends to cause irregular contraction or spasm which would disturb the normal social function of an individual. This might cause a social stigma that they can't attend any parties or attend any marriages and things like that. So they would be socially withdrawn because of this continuous spasm. Sometimes it might cause problem with the reading because this tends to cause frequent blinking and closure of the eyes. Sometimes while driving also this causes problem. These are the three things. One is the continuous spasm which should stigmatize the person. Secondly, the problem with the driving or reading. But usually that doesn't occur because because it hardly ever occurred on the opposite side. I mean on both sides. Alright. So this might cause, apart from the spasm, this causes clicking in the ears. Sometimes the spasm of this muscle called platysma. Then what are the causes for this particular condition, hemifacial spasm? Most cases there might be a compression of the one nerve called facial nerve with a branch of the vertebral artery called a posterior inferior cerebral artery, or we call it pica, or maybe even the vertebral artery sometimes gives a kinking and a tortuous course which might compress the seventh nerve, which would cause this aberrant excitation and cause this some sort of a short circuit like effect with a continuous spasm. This doesn't cause pain. That's a good thing. This, if at all it causes some spasm, that's all. This lasts for seconds, minutes, maybe even longer, occurs many times a day, even during sleep. So usually this doesn't need any investigation. But if this occurs in young people, because this disease usually occurs in the middle age, maybe 40 or 50 years, and it's more in female, maybe at 2:1 ratio, maybe 7 to 14 per lakh. It's a 7 per in males as well as 14 per lakh in females. And we don't usually recommend any investigation like MRI unless it occurs in young people, because in those people there is a high chance that this might be associated with some condition called multiple sclerosis or in lesion in the brainstem, or maybe any lesion when the nerve enters into the brainstem called a CP angle or the cerebellopontine angle, that maybe some tumors or something. But those things are quite rare, extremely rare. I haven't seen any patient so far with this tumors and all. Maybe it's there, but most of the cases it is idiopathic or maybe some vascular compression. So what are the things which would simulate hemifacial spasm? There's a condition called a blepharospasm. There's a continuous blinking in the eyes which would simulate something like hemifacial spasm, and certain drugs like neuroleptics or those drugs used in psychiatric medicines which would cause some oromandibular dystonia, some irregular movements around in and around the face. Sometimes there can be some masticatory spasm that is painful, that is not related to this. Or maybe there is a condition called tics, that means you go on doing things, it flows from one side to the other, that might affect the face, called facial tics, but this you can suppress. But hemifacial spasm you can't suppress it. That means this tends to go on for, it will irritate you. So how will you treat this case? So you can do a relaxation, you can do massage, you can do various drugs like clonazepam, phenytoin, carbamazepine, gabapentin, and other benzodiazepines. Most of the cases this will stop working after a few weeks or months. In those cases we have two options left. One is a injection called a botulinum toxin injection. That's actually it has been used since 1970s and all without any side effect. We use with a small insulin syringe and we inject at these areas, the upper eyelids, the lower eyelids, this part of the face as well as this part of the face, especially to prevent contraction or spasm of this muscle, and hardly ever in this part, because once if we inject here, this tend to droop here. So this can be the problem with this medicine is that the effect lasts 3 to 6 months. But many of my patients have been taking this medicine for the past 10 years without any problem, and some people used to take maybe once in a year, but hardly ever occurs any resistance. Though it's been reported that this causes antibody formation, but that's usually is not a major concern. Secondly, MRI and all usually not indicated, but sometimes there is a condition called epilepsy, focal epilepsy. In those conditions, you might need some in consultation, maybe to roll out any seizures, maybe an EEG, maybe serum calcium level, blood sugar level, like that. So it means the hemifacial spasm is usually it's a benign condition. This causes just spasm of the muscles and some occasionally some clicking in the ears, and hardly ever we recommend any MRI. We can start with the oral medication. If it doesn't work, we can go for botulinum toxin injection. That has to be given every once or twice per year. It has to be continued. And if you are not interested in this injection, then the next option is a microvascular decompression. That is you put some graft between the artery and the nerve, so that there won't be any extra irritation or short circuiting between this artery and nerve, because this causes some ephaptic transmission, some aberrant renovation, like that. So in order to prevent that, you put some graft. That's called a microvascular decompression. This is done by a neurosurgeon. We use the botulinum toxin as well as the medicines, and most cases it has been found to be effective. Both microvascular decompression as well as the Botox effective in 85 to 95% of the cases. 5% it can still return, or it might not be effective. Okay. If you have any queries or questions, please come in. Thank you. Thank you very much.